Hello, good evening. So, welcome to one more session where we shall be talking about all the competitive exams of medical career. Well, I am Dr. Bankim Jani and I did my MBBS. I am a radiologist plus I'm a radiologist with specialty in MRI spine. Plus, I've got interest in sports, so I'll show you that I am a marathon runner, plus the painting and few more things, right? But we'll discuss as we proceed about it. These are some of the medals which are for marathon, ultra marathon, and long distance running. Okay, so why we are here? Two reasons. So sometimes what really happens is we take the exams very lightly, right? When you are in medical, it is not so that you are competing with your own class or you are competing in your own city. You are competing at a national level and even international level, right? So these competitive exams, these are the exams which will take you to the next level, to the higher levels. Now let's say after completion of your MBBS, right, whether you do it from anywhere, you need to appear for certain exams, whether you want to practice in USA or you want to practice in Canada or you want to practice in, let's say, UK, you want to practice in India. So there are various exams, competitive exams for that. This is so vital, and that's why we are over here. The second reason is that every Wednesday, Saturday, and Sunday, we have planned to conduct these special sessions. Say today is Wednesday, so we'll be talking about national exit test and we'll also be talking about PLAB, the exam which is very important if you want to do practice in UK. On Saturday, we shall be discussing at length about USMLE because it's a long topic, right? So we'll be talking about it on Saturday. And on Sunday, this is a very special session for students as well as parents. This is very, very vital for the success in medical career because it's not so that as a student you only study. In fact, it would be like that even the involvement of parent is so important. Another thing, looking at the request of everyone, we have turned the chat on. So now chat is on, right? So you can definitely write. The chat box is right in front of me. So if you want to ask any question, don't hesitate, don't wait. You can straight away ask the question. I'll incorporate the answer of that into our discussion, right? So that is the point. In association with Vishwa Medical Admission Point, now onwards we'll call it as VMAP, right? So last year also we conducted many training sessions. This year, what we thought is that these competitive exams, they are so vital. You prepare right from the beginning only when you understand the importance of it. Bas. So that's the intention. So that's the reason in association with VMAP will be coming every Wednesday, Saturday and Sunday. Wednesday and Saturday it will be at 8 p.m. and on Sunday it would be in the afternoon, that is 11 a.m. right? That would be the action plan, right? So don't miss it. It is exactly like that. If you want to go in war, then wars are won by better preparation. So this is where we'll be giving you a complete step-by-step method and the preparation plan, right? So let's look at the scenario. The scenario is, here is a student, right? He appears in his NEET exam. Score is fantastic, right? He is a ranker, score is good. He gets say MBBS admission in India. So government medical college or other colleges, but he gets. For some reason, those who have scored bit less, for them the option is they are dedicated, they want to do MBBS, they want to become doctor. So in that case, what they do, let's move on to the foreign countries, right? There are foreign countries where it is possible to do the MBBS. Now, see, there are few hurdles. You ask this question to 10 different people, they'll be giving you 10 different answers. So let's sort all of them one by one. Someone would say, you must go for this NEET again, right? Go for it again, waste one more year. There are few students who have wasted 3 years and then they go in frustration, right? Frustration. I would say that yes, if you have fallen sick or if there was some unavoidable circumstance, some accident or any sort of thing, and then if you think like, chalo, let me give one attempt, let me go for one attempt of this NEET again, so then that makes a sense. But otherwise, simply because someone said, nahi, go for one more trial, go for one more trial, don't do it. I'm telling you that the 1 year which you have lost, right? Let's say you lose 1 year. You know how much would it cost in your life? I always say it like this. In your life, at any stage, will you be earning at least, say, not much, but I'm just giving you a very small figure. Yeah, this is a small figure. Just 50 lakh rupees a year. Will you be earning? No doubt about it. No doubt about it. I'll give you the exact plan. Study properly so that earning this much is not at all difficult. Because see, today nowadays even the interns, even after internship, when you go for post graduation, the first year residents, they are getting 80,000 plus stipend. So 80,000 means it's what? First year resident is getting 10 lakh rupees a year, right? So by delay, when you delay the whole process, कि चलो, let's appear for NEET again, second year, third year, you are losing this. So at one stage of life, right? At one stage, when you become senior, at least earning 50 lakh rupees, that would not be a difficult thing. When these years are wasted, that entire thing is slowed down, right? And in any case, you have to face the reality, you have to face the medical career, right? So do it right from the beginning. It's like in NEET, whatever your score is, right? Decide what is the best possible option. So one, the mails, many times emails they come that should we go for second attempt, should we go for third attempt, etc. Right? I don't say that you go for it unless there is a specific reason, then the matter is different. Right? Second option. Second, we get the emails where it is said that go for Ayurveda or go for homeopathy or go for any of these alternate science, alternate medicine, etc. And after that, you can do the post graduation. And that post graduation is what? You can do the post graduation and then you can become radiologist, you can become orthopedic surgeon. This is because we can't speak Gali, but this is absolutely nonsense. Complete nonsense. No, post graduation, those seats, I'll show you how you will be getting it. How you have to really go for that national exit test and then as per merit, those seats are given. Not this way, right? If someone is telling you these, again, a big no. I'm not telling that Ayurveda is bad or homeopathy is bad. No, but they have got no place if you are planning to go for post graduation, right? It's a completely different thing. So don't be carried away by anyone who is giving all such say false dreams, right? Don't trust. So this is very, very vital. Third thing, when we say you want to go for medical, right? They say that you don't get good education over there, or education in India is better. Well, the real fact, right? Not insulting any of the teacher, but in medical, you do it from anywhere in the world. What really matters is your understanding. Your understanding. You can't cram. If you are trying to cram, ratification, you are gone. You need to understand the thing. Once you understand the subject properly, if your foundation is proper, then there won't be any problem in the future, irrespective of from wherever you are doing your MBBS, whether it is India or it is abroad. It won't make any difference. But the understanding is vital. Due to this specific reason, last year, right, you can watch it on my YouTube channel. Last year, we conducted so many sessions on anatomy, physiology, right? And then there were few sessions, in fact, many sessions, they were on like cardiology, the entire ECG was taught. Why? In a first year, I'm teaching all these things? Yes. Because when you know ECG well, when you know the radiology, that is even the basic X-ray chest, you know well how to study. Because see, in anywhere, the moment you take admission, in the eyes of your parents, relatives, you are a doctor. You are a doctor, right? And then they'll say, doctor साहब जरा मेरा ECG देख लो ना, my X-ray देख लो ना. Then comes the trouble. कि क्या देखे? If you are learning anatomy, you have got all the rights to learn these things. Radiology, ECG, these are the basic important things, right? And nothing comes overnight. कि चलो एक ज्ञान एक second में एक overnight you get it. No, don't do it. It never happens. No ratta. We are over here not only for the admission, but also so that you become a successful, good doctor. And that's why all these trainings, they are kept only with this particular intention, right? And so many things about the training part, but we'll talk about it as we'll become more familiar. We'll keep on discussing the things. Yeah, you can always ask a question in case if you have any doubt, any question you want to ask related to the subject, you can always type, right? That's why I have kept the chat on. Otherwise, to say this is the schedule: Wednesday, Saturday and Sunday. Wednesday, today we'll be talking about national exit test in detail, about the PLAB in detail, and then on Saturday USMLE in detail, and Sunday very exclusive sessions which is for your parents as well as definitely for you, right? So here it is, our MBBS, right? And we are telling that this MBBS done from India or done from abroad. Now till this point, right, till this point, that is till today, what was the scenario? One who has passed MBBS from India, straight away he'll be appearing for NEET PG. NEET PG. Right? He'll be appearing for his exam in his college, in his university, done, complete, and straight away appear for NEET PG. One who has done MBBS from abroad, up tak, they were supposed to give this foreign medical graduate examination, FMGE. After clearance of this exam, they have to appear for NEET PG, and then the PG would start. This was the scenario. Now in this case, yes, someone who is doing from abroad, someone who is doing MBBS from Georgia or Kyrgyzstan, Kazakhstan, right, anywhere, they are at a loss due to this FMGE. They have to appear for this exam extra. But from this year, things would be completely different, right? There is the exam which is called as the National Exit Test, lovingly called as the NExT. So whether someone is doing MBBS from India or from abroad, no difference. It's same, right? If someone is doing from India or from abroad, there is no difference. They have to appear for this NExT. This NExT is divided into two parts, part 1 and part 2. Part 1, which is theory, part 2, which is practical, right? I'll tell you in detail about it, but this is, I'm giving you a very general overview so that you become clear that what exactly are we talking about, right? Theory and practical. In theory, 50% would be passing, right? It's a full 1 day exam, right? 1 day exam. 3 days exam, right? It is a 3 days exam, and every day it would be morning, evening, morning, evening. I'll show you the details. But the point is that over here, a score would be given. There would be a score. Is this score important? Very important. Because this is the score which will entitle you for the competition of PG admission. So your postgraduate admissions, they will be based on this. Now, as such, if you see, this is a very good thing. You know why? You have done MBBS from anywhere in the world, but you give your heart and soul, you study properly, right? Irrespective of in which country are you, you study properly, you are straight away competing with students across the whole world, right? Whether someone is passing from India or someone is passing from any other country, but then everyone will be going for these exams. So everyone is interested in this post graduation. So yes, you are also into that race. There is no extra burden, right? So this is where the score would be given. After this, say there would be practical, and in this practical, it is just pass or fail. Right? There is no score, but it is necessary to clear this exam, so that from the perspective of medical person, right, you should know the practicals, you should be having the clinical skills. So your clinical skills will be evaluated over here, right? But the result would be in the form of pass and fail. That's the reason that this score is so important. This part 1 exams, that score is so important. And then the post graduation starts. So one thing you must have understood is that it is a good thing. It's not a bad thing, right? People say, are a new exam next, but that is at times when they speak, they without understanding, they keep on giving the comments without understanding, right? The idea is that it is that irrespective, our Indian students, I just say Indian students, you are Indian student, right? By doing MBBS from abroad, still you are an Indian citizen, right? So it is not so that you become some alien when you do MBBS from abroad. Everyone comes at the same footing, at the same platform, and then chalo, exam. So this is true for everyone, and this is implemented from, it is getting implemented from 2023, right? December 2023 would be the first exam. So definitely say if you are in first MBBS, definitely after 5 years, so this NExT would be there without beyond doubt, right? In case if anyone fails, then again, no issues. Attempts. How many attempts? There is no restriction, right? There is no restriction. One can appear for this exam as many times, but with proper preparation, there should not be any problem. This no restriction doesn't mean like that one can appear for 20 times, right? There is a reasonable cutoff, and that cutoff is 10 years, right? Sufficient, right? 10 years of joining your MBBS, joining MBBS. So practically speaking, it's fine, right? Not to worry about. So when we say that yes, it is good, beyond doubt, it is good to do MBBS. One interesting mail came that can I be a dancer? Why not? Say, my father told me that you be a doctor. I wanted to become a fighter pilot. Right? He said, okay, fine, you pursue all your hobbies later. But in India and in the entire world, in India the situation is still bad. Say if the 100 doctors are needed, we have just 4. This is the problem, right? There is so much of less medical power, right? So it's very clear that you will never be having any problem, but your knowledge, that should be outstanding. So for this I would say only one thing, that beta, this is your life, right? We divide it into 2 parts. This is the part that is still your, let's say 25, 27 years, right? That is where when you are a student, right? Study and study hard, right? Without any mercy on yourself. Study, kill the competition, because at a later stage of your life, later stage, when you have to work, it would be hard work, but the difference between this is, यहाँ पे वो कहलाता है मेहनत and यहाँ पे मजदूरी, right? This is the difference. This is the difference. We waste so much of time over here and then we struggle for rest of the life. Why to struggle? Finish the struggle, right? Work effectively over here, learn everything very happily. Because when you know your subject well, my teacher used to say that when you know your subject well, you will find that your health would be good, your mood would be good, right? This would be good, mood would be good, you will feel happy, you will eat happily, you will sleep happily, right? Everything would be so nice when you know your subject well. If you don't know your subject well, the trouble, right? Then there is anxiety, then there is stress. Don't let that thing happen. Yeah. So there is a question, means if we pass next after MBBS, then there is no other exam for MD or PG. Wait. The thing is, let's understand it a bit properly, right? Now see, this is good. This is how you should, without waiting for anyone, right? You should really ask the question immediately. I really like that. So, Sambata, the thing is, as I told you, this is MBBS, right? You do from anywhere. After that, you appear for your national exit exam, so that you have cleared your MBBS from India or from abroad, and you appear for this exam. This exam will give you postgraduate admission, PG admission. That means whether you want to become a radiologist, you want to become orthopedic, you want to become surgeon, MD, MS, anything you want to go for, right? This is the exam which will take you to the doors of PG admission. Depending upon the score, you will get the admission, right? And then your post graduation would start, first year, second year, third year, right? So obviously you have to appear for these exams over here, but they will be pertaining to that particular subject. Let's say if I'm a radiologist, so then I have to appear for MD radiology exam, correct? But previously, the trouble was that if you had done MBBS from abroad, first you had to go for Foreign Medical Graduate Examination FMGE, and then you had to appear for this NEET PG, NEET PG, and then the PG used to start. So in case if anyone fumbles in FMGE, right, the people there were so many kids wasting their time, right, frustrated so badly that 1 year, 2 year, 3 year is getting wasted, and then they would feel कि यार अब कब ये this FMG pass होगी, and then they have to appear for NEET PG and then the PG admission. So this entire process goes painfully slow. Now study properly and straight away one exam, this NExT, because even if you are doing it from India, again you have to appear for this exam. Everyone has to appear. You got my point? Because say MD or PG, those exams, so they will come as whatever the field which you have selected. Let's say you are going for MD radio, right, MD radiology, so obviously the radiology the exam would come na, right, by the end on the in the third year, so it will come, right. If you are planning for MS ortho, so yes, that exam would come. You got my point? Still, if any doubt, let me know. So this is the whole idea, right? Now how are these exams placed? What exactly would be asked over here? I'll slightly elaborate on there are two types of exam. One exam in which you just cram the subject and go. Literally ratification, and this is one of the worst thing. This is one of the worst thing. Welcome. So why I say cramming is worst? You cram to the best of your efforts, don't revise it, and then you'll start forgetting. But if you have understood anything properly, then it would be like a game, it would be like a pleasure, right? Say you put the stethoscope, trust me, you go for, you are a doctor, right? Your first posting, right, in internship, when first posting, my first posting was in a small village, right? At that time we feel यार stethoscope लगा के जा तो रहे हैं, then will we be able to handle these patients? Because then you are all alone, you are the boss, you are the boss. But then that gives you the confidence. Whatever the time which you have spent in clinics, the number of patients which you have seen in OPD, right, there you get that completely different feel, right? Because then you start remembering, yes, 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 we have seen this case, this is how you handle it, and your confidence, it keeps on increasing. So exactly like you read best of the books of the world on swimming, right? Best of the books. Jump into water and see what happens, right? You can't learn swimming without jumping in water, simple as that. Impossible. But this is that thing, right? This is the same thing. That's the reason now the format has changed completely. USMLE is that exam, United States Medical Licensing Examination. This is the big boss. This exam is like where you'll be asked the question, not in the form of say as if you have crammed anything. They will be asking the question where you have to diagnose. You have to diagnose. You can diagnose only when you have understood the thing properly, right? You cannot diagnose by cramming anything. When you'll be learning ECG, you'll feel it's like a game. It's like a game, right? As if you are like a detective. You are watching the heart from right side, you are watching the heart from the left side, you are watching the heart from underneath, right? For people it is just like अरे ये क्या line है? But for you, you know that just by looking at these lines, you know that whether the right side of the heart is beating properly, left side is proper, right? Atrias are okay, ventricle is okay, right? If there is infarction, if there is heart attack, so then which part is involved? So complete electronics, right? It is like you are learning electronics of the body. When you learn neurology, you will find that supercomputers are nowhere near to your brain, right? It is one of the most fantastic thing. So USMLE is the exam which is required if you want to do practice in USA. Those, trust me, national exit test NExT, it is made exactly with the same purpose. This is the exam where the weightage would be given for your understanding, for your diagnostic skills, right? So that's why I say that this national exit test is like sister of USMLE. So once you clear this, then USMLE's confidence, that would be very high. This is super exam, super, right? And this is what we shall be discussing on this Saturday. Okay. Acha. So this national exit, it is a 3-day exam. Day 1, right? Day 1, day 2, and day 3. Day 3. Now, before I go into the details of day 1, day 2, day 3, the whole medical course they have divided very nicely into the form of the main subjects, and the elite subject. Elite subjects. The subjects which are important, but they are say like merged with even other questions also. So it will be like a combination. On every day, day 1, day 2, day 3, there would be a pre-lunch session, pre-lunch, and then there would be a post-lunch session, right? Post-lunch. Just for clarity, they don't provide lunch, right? Lunch is to be arranged by yourself. But these exams are like pre-lunch and post-lunch. So pre-lunch, post-lunch, pre-lunch, post-lunch, right? So there would be 6 sessions. 6 sessions in 3 days. How is this exam organized? Well, this exam would be a combination. When I say it would be a multiple choice question exam, MCQs. I have not said that they are single line questions, right? They are not single line questions. There could be some long answer questions. There can be some short answer questions, right? Long answer questions is like, say, for example, you will be given the complete history of the patient. And then from that history, from those findings, you have to come to a probable diagnosis, and where the options would be given, and you have to select the correct option, that whichever is the correct option, right? So that's how things would go. When we say multiple choice question, not necessarily it would be one liner, right? There could be some short answers, but it would be always a combination. See how different the examination pattern has become, which is focusing on your understanding more. Right? So during these days, total number of questions, that would be 540 questions, which you'll be answering in the span of 3 days, total 540 questions. Exam is online. Right? Exam would be online. So straight away on computers, 50% would be the passing. Right? Once you pass, listen carefully, once you pass, whatever the score which you have obtained is final. Done. Right? This is the final score. It means there is no scope of retest. कि चलो मेरा score कम आया तो I appear for this exam again. No, you can't. You can't. Once clear, done, straight away you appear for the second national exit part 2. Right? This is why one has to study very meticulously, very sincerely, very sincerely. Here is the pattern. This is national exit exam or test day 1. Right? Over here, the pre-lunch session where medicine, that would be the main topic, main subject, your medicine. Dermatology and psychiatry, they will be like a lead subject. 3 hours, 120 questions. This means like 40 questions per hour. right, per hour. 40 questions per hour. Not bad, right? Post lunch session. Now the focus would be only on pediatrics. 90 minutes and 60 questions. So once again, logic comes to same. It is like 40 questions per hour. Now when we say 40 questions per hour, that means it is just about 1.5 minutes. That is 90 seconds per question. 90 seconds per question. The idea is absolutely like your diagnostic skills. How fast you can really come to a conclusion. Even in real life, patient tells that I am having these symptoms, and then you say, "Acha boss, dekhna padega," right? And you take out the book and you start reading, "Acha neurology, so these are the signs symptoms." No, it never goes like that, right? You have to come to a conclusion quite fast. This is why that when we'll be giving you training, right, that we are planning for that, and that is what is called as the integrated approach. Integrated approach. Integrated approach is like preparing you right from the beginning in such a way that forget about this national exit test. Any exam of the world you should be able to clear on a first stroke, right? And that is what gives you so much of confidence, right? So over here, national exit exam, day one, pre-lunch and post-lunch. And pre-lunch, it is this medicine, right? That is the main subject. Dermatology and psychiatry, equally important, right? And post-lunch, we have got pediatrics, 90 minutes, 60 questions. Same pattern will be followed for all the 3 days. So day one, this is for day two, where the pre-lunch is surgery, right? In final MBBS, you will find medicine, surgery, and gynae. That is gynec and obstetrics, right? They are considered as 3 prime subjects. So on day 2, we have got another prime subject, and that is surgery. Orthopedics and anesthesia, they are also asked in 3 hours, 120 questions. Post lunch, we have got ENT, 90 minutes and 60 questions. Same style, right? Day 3. Day 3 is obstetrics and gynecology and the radiodiagnosis, right? So they are again 3 hours, 120 questions. Post lunch, ophthalmology, eye, 90 minutes, 60 questions. This is how the exam would be conducted, right? Now, this exam would come in December, right? Not for you guys, right? But for those senior batches, right? December 2023. But same thing after a few years, so you will also be appearing for this particular exam. So December 2023, right? Second week, it is National Exit Test, that is NExT, step 1, right? That will be in December 23, second week. Second week. You get the result in January. In January, you get the result. Now, it is necessary to pass in all these subjects, right? So, if someone fumbles, if someone fails, so then there is a supplementary exam. That supplementary exam. That exam comes in January, right? So that exam in January, appear cleared, and then straight away you go for the internship, right? You go for the internship, 1 year internship. As you have passed, so now you are there for internship. After you come back from internship, you appear for next exam, step 2. Step 2 is just pass and fail, right? And then you go for your PG, right? Post graduation. See how systematic the things are, right? Everything is very well planned. This is the exam pattern. This exam pattern: problem solving, comprehension, analysis, recall. What's that? Problem solving, in simple words, those diagnosis. Diagnosis. Problem solving means, in medical, problem solving is diagnosis, right? Recall. Recall is that all rata, right? All those ratas, those cramming part, whatever it has been done throughout the years, that is what is asked, because it is like an information, right? It is like an information. Kitna yaad rakha hai? Bas. Comprehension analysis, once again, it is a sort of diagnosis, right? So this is where you have to go in depth into the subject. So much better advantage, because we always study when there is exam. If there is no exam, we don't study. So now when we know that yes, they'll be asking questions like this, so right from the day one, our mind will be going exactly on these paths. Exactly on these paths. So then it will become a habit. When it is habit, good habit, you will develop the skill also. Right? So that is how we go for it. The next plan, right? The next exam, this is again making it clear that after you have finished your MBBS from the college, right? Whether Indian college or abroad, and then you are coming back and then you are appearing for this exam, right? Now, say after completion of this NExT, someone has cleared, passed, right? Then first thing what he would do, he can write doctor and then your name. Yes, it is allowed, right? It is allowed at this point. And if someone tells that, yes, I want to just go for my practice, no problem. You are most welcome to do medical practice in India if you have done this NExT exam properly. In that case, score won't matter, right? You go for your internship, you come back, you appear for next two, right? Step 2 and done. You can do private practice, private medical practice in India without any hesitation, right? Very clear. Anything you want to ask till this point, because our next step would be that what exactly is this PLAB? This is once again a very good exam. So if everything is fine till this point of time, we move on to the next point. And anything you can ask. I'll write something, right? Meantime, don't worry for anyone else to ask the question. Right? This is once again a very important habit to develop. Always be a leader in asking questions. Ask immediately, right? Don't leave anything in your doubt. So whether it is like medical studies or life, everything should be crystal clear, right? So that way you'll be very happy. Okay. So negative marking? No. No negative marking. No negative marking. Just you answer. Till this point, they have not come up with any negative markings, and it is not there, right? It is not mentioned. So not to worry. PLAB. MBBS you have done, and you feel like that I don't want to practice in India, I want to practice in UK. Well, no worries. There is no prerequisite that in order to practice in UK, you have to clear this national exit exam. No, no, it is not needed. Right? If you want to practice in UK or you want to practice in, say, Switzerland, right? You want to practice in Switzerland. Only MCQ is asked, or we have to do practical also? Well, MCQ is asked in step 1. Practical, it is asked in step 2, right? So step 1 is only MCQs. Only MCQs. Practical, step 2. In step 2, only practical. Only practical. Right? It is the score of step 1 which is important for your PG admission. So coming back to this PLAB, PLAB is Professional and Linguistic Assessment Board exam. So see what it's professional and linguistic. So when we say linguistic, that means it is the ability, your ability to speak, right? Your ability to speak. So it is the professional and linguistic assessment. There is a board. So this is a board exam, right? Board examination or the exam. That is PLAB. You want all the details? Well, you can go at gmc-uk.org. Right? So that is where this is dash gmc-uk.org. So you'll get the information. But I'll tell you what is there. PLAB is divided into two parts, right? First and second. This is 180 MCQs. And I've seen that those MCQs, they are pretty easy, right? As compared to, say, USMLE. 3 hours. 3 hours for 180 questions. And these questions, they can be, even some of the questions, they can be scenario based. Scenario based. Right? How much they charge for it? It is £239. The second exam is called as the OSCE. OSCE. OSCE, in simple words, it is like a simulator. It is like a simulation. You will be given the simulation as if that's a patient who is suffering from any of the specific disease, and he'll be having all those sign symptoms. Right? So this OSCE, right, sort of tongue twister, it is objective structured clinical exam, right? So see, it is medical. First part would be the theory part. Once you clear it, you will be taken for clinicals, right? So this is a clinical exam in PLAB. This is quite similar to a simulation. Very similar to simulation. Simulation means what? You'll be given the scenarios. There would be, say, 16 scenarios which you have to reply, which you have to answer. 16 scenarios. So practically speaking, that when things go this fast, right, you have got just 6 to 8 minutes to solve every scenario. But in this exam, there are only pass or fail, right? You have to just pass and it is done. The site which I gave, gmc-uk.org. Over here, you have to create your account. Exactly the way you make your email account in, say, Gmail, etc. Right? Quite similar. Quite similar. You just make your account because you will be tested for two things. You'll be tested for two things. One, medical knowledge. Well, so far so good. But you will also be tested for your English knowledge. You'll be tested for your English knowledge. So our IELTS, that would be needed. That is for the English knowledge. And then you go for, say, PLAB 1, then you go for PLAB 2, right? And you finish it. After that, you'll be entitled to practice in UK or Switzerland. What about the attempts? Now, that is pretty typical, right? What it is, that 4 attempts would be permitted. 4 attempts. In case if there is a genuine reason, one can go for the 5th attempt. Otherwise, on site, so they will write only one thing, that only 4 attempts are permitted. But this 5th attempt, one can try, one can appear, but only thing for that, they have to go for GMC permission. This is what takes away, right? The 4 attempts they are there, and in case if someone is requiring 5th attempt, so they have to give the reason and then the permission is granted, but not more than 5 attempts, right? We say that we should be successful in the first attempt only, because we have got enough time, so prepare properly right from the beginning. Achha. So let me show you the complete pathway. The pathway would go something like this. Say you have already created the account. Account is ready. Then appear for IELTS. After IELTS, the score of IELTS is valid for 2 years. Right? Valid for 2 years. After IELTS, it would be PLAB 1. Right? PLAB 1. Within 2 years, you have to appear for PLAB 2. So here also, this is the restriction, that once you have started, within 2 years, that once you have started, then keep finishing it properly, fast, right? And then the GMC registration, right? GMC registration, and you are a doctor. Right? So that's how one has to really prepare. Right? Crystal clear, that 3-day exam and divided into 2 parts, and the questions, they go on the basis of problem solving, comprehension, recall, like that. So national exit score, first is its score is important for PG admission. Step 2 is just pass and fail. And as we saw, the PLAB, right, and how the PLAB is organized. Once again, just for a quick revision, it is Professional and Linguistic Assessment Board exam for the practice in UK and Switzerland. gmc.uk-uk.org, and do register yourself, right? Register. Step 1, 180 MCQs, 3 hours, scenario based. Step 2, objective structured clinical exam, OSCE, simulation based, and in which the scenarios are asked, right? Pass fail, but say you have to appear for IELTS. You have to appear for IELTS, and then PLAB 1, PLAB 2, right? And finally, so this is the whole path. Just a small note that IELTS is valid for 2 years. Once you have cleared your PLAB 1, then within 2 years you have to clear your PLAB 2, right? Otherwise you have to start all over again. And then you can go for GMC registration. So this was the whole plan. In case of any question, right, you can definitely ask me over here, right? And on this Saturday, don't miss it. Saturday at 8 p.m. we meet, and we'll be discussing at length about USMLE. That would include even that how to watch whether your college is into WDOMS, World WDOMS, World Directory of Medical Colleges, medical schools. That is called as WDOMS. So I'll show you how to see whether your college is into that directory, because you'll be requiring what's called as the FAMER number. So this FAMER number, it gives the eligibility that yes, the college from which you have passed existed, was working properly, and then a unique number which is given, that is the FAMER number, that tells the whole story, that this is the identification, right? We'll see about all these things in detail along with the site where you'll be able to see that where to register, right? So that is what we wanted to discuss today. Thank you so much. At any point of time you want to ask any of the question, you can. And plus there is a number, right? There is a number which is the helpline number of Vishwa VMAP, right? So that you can always be in touch for any of the queries. So thanks a lot and wish you all the best, and we meet on Saturday. Thank you and bye-bye. In Georgia. So in Georgia, MBBS has 6 years, which include internship. See, once you complete your final MBBS, now, right? Once you complete your final MBBS, you will come for NExT, because that is the point when you appear for this exam, and then it would be your internship, but the score which you have obtained over here, that score would be for your PG admission, right? Internship and our post internship going for the next two, right? That is the clinical exam. It is just pass or fail, so that is fine. Your admissions are over here. So yes, once you complete your final MBBS, you have to come back for the national exit test part 1. So yes, it is needed. This is if someone wants to practice in India, right, Sakshi? Very important. If you want to practice in India, and if you want to appear for post graduation. Why would you do that? Because after Georgian internship, can I write for NExT? You can. No one would say no. But then why would you waste 1 year? Right? The moment final MBBS exam is complete, right, you are eligible for the next one. You are eligible for the next one. On Saturday, I'll show you that many of the students, they say that after completion of the MBBS, why not to try for US? Why not to try for US? Yes, you can. But for that, be very clear that you have to start working right from the first year, because by the end of second year, you'll be appearing for USMLE part 1, step 1, right? Just by the end of second year, I'll show you all the reasons. Because USMLE is something which one should do parallelly. So that way you will excel in your college studies also, because you are going for a difficult exam, right? Much more difficult exam as compared to others. But you have got enough time, so you can always kill the competition, right? Anything else anyone wants to ask? You can. Okay, so once again, thanks a lot and see you on Saturday. Thanks and bye-bye.